Yesterday, Oxford doctors Nick Maynard and Deborah Harrington briefed parliamentarians very movingly about their experiences of treating people in Gaza. They impressed on us how important it was that they were kept safe, how many of their colleagues had died, and I'm sure the Minister and the whole House will thank them for their tireless work, and other aid workers and anyone who gives over their safety to save others. They also pointed out that the malnutrition that we are seeing now is making patients more vulnerable to infectious disease. And there is a report released by the London School of Hygiene and Tropical Medicine that has projected that if it continues as it is, 74,000 excess deaths, that's beyond those who have died by bombs, will die if something isn't done. So will the Minister agree with me that the only thing that needs to happen now is that immediate bilateral ceasefire, but also a rebuilding of the medical situation in Gaza now, not later, because that is what's stopping people from getting the life-saving treatment they desperately need?
Minister.
I join her in praising the vital work of aid workers in the most challenging of circumstances and highlight the courage and bravery that they demonstrate. And obviously we want to make sure that we create the conditions in which they can operate more safely. She calls for a ceasefire. We call for a pause that can lead to a sustainable ceasefire, which will enable that to happen. And of course, as we move to that situation, then some of the issues she talked about, particularly around providing that extra medical support, can be provided.